Good morning, everyone. My name is Kyle Rojas-Legleiter. I'm the Senior Director of Policy Advocacy at the Colorado Health Foundation, and I want to welcome you and thank you for joining us for today's conversation about Pulse, the Colorado Health Foundation's annual poll. Dave, you can click ahead to the next slide. And we're going to begin today with a few sort of housekeeping notes about the technology that we're using today and a very important walkthrough of our Spanish language interpretation features and a statement about our commitment to language justice. I'm going to turn it over to my colleague Valentina to explain how interpretation is going to work on today's webinar. Go ahead, Valentina.
Thank you so much, Kyle. Hi, everyone. Good morning. Hola a todos, a todas y a todos. Buenos días. Mi nombre es Valentina y estoy aquí por parte de Community Language Cooperative para ofrecerles y garantizar su compromiso con la justicia del lenguaje. La justicia del lenguaje es un tipo de interpretación simultánea que busca crear espacios en los que no dominen ningún idioma, espacios en los que todos puedan participar en el idioma de su corazón. Para lograr este objetivo vamos a utilizar la función de interpretación de Zoom. Entonces lo que verán en un par de minutitos es que aparecerá un nuevo botón en la barra inferior de su pantalla, en donde tienen ahorita los mismos botones para el chat, para el micrófono, para el video, etcétera. En esa misma barra va a aparecer este botón que parece un globo terráqueo. Cuando vean este botoncito aparecer, hagan clic en él y seleccionen inglés o español como el idioma en el que desean escuchar y participar. Si ustedes están en esta sesión por medio de una tableta o de un teléfono, encontrarán las mismas opciones para la interpretación haciendo clic en el botón que tiene tres puntitos en la esquina inferior derecha de su pantalla. Ese botón dirá More o Más. Hi, everyone. Good morning. My name is Valentina, and I'm here on behalf of Community Language Cooperative, and I'm here to provide and guarantee your commitment to language justice. Language justice is a type of simultaneous interpretation that seeks to create spaces in which no one language is dominant, spaces in which everyone can participate in the language of their heart. So to achieve this objective, we'll be using Zoom's interpretation feature, and what you will see in a couple of minutes is that a new little button, a button that looks like a globe, will appear on the bottom bar of your screen, on that same bar where you currently have the buttons for the microphone, for the video, for the chat, etc. It will be towards your right hand. Once you see this new little button come up, go ahead and click on it and select either English or Spanish as both the language that you will be listening into and speaking into. If you are joining the meeting on a phone or on a tablet, you will find the same options for interpretation by clicking on the button with the three little dots on the lower right-hand corner of your screen. This button reads More. Un breve recordatorio es que la interpretación es simultánea, entonces por favor mantenga un ritmo de conversación cuando participe. Si tiene alguna pregunta o algún problema con esta tecnología, por favor comuníqueselo al grupo completo a través del chat para que lo podamos resolver en conjunto. Muchas gracias por tenerme por acá. A quick reminder for those of you that do prefer to use English during this meeting, Spanish is 20 to 25% longer than English, so just be aware of your speed, keep a conversational pace, and if you have any questions or any issues whatsoever with this technology, please let the whole group know by means of the chat box so that we can work together to address them. Thank you so much for having me here. We can go ahead and start the interpretation channels now.
Thank you, Valentina. And once again, thank you all for joining us for today's webinar. We really appreciate having you here. A few other housekeeping reminders. We are recording today's webinar so that it will be available both to you and to others after today's briefing. That means that we have muted all participants and your camera is off, but that does not mean that we don't want you to actively participate in today's conversation. We really do hope that this briefing is a conversation. So we encourage you to use the chat function throughout the briefing today to ask your questions, to talk about your curiosities, the things that strike you in the data and the information that we're sharing about Pulse, the Colorado Health Foundation's poll today. Closed captioning is also available via the control bar at the bottom of your Zoom screen today as well. And if you have technical difficulties throughout the webinar, feel free to reach out via the chat and help us to troubleshoot them for you. Dave, you could go ahead and advance to the next slide. I want to start out with just a quick mention and welcome from the Colorado Health Foundation. If you're not already familiar with our organization, the Colorado Health Foundation is a statewide philanthropic organization that champions the overall health and well-being of every Coloradan by advocating and investing in solutions and policies that drive health equity and racial justice. We do so with a rally cry that health and well-being can be in reach for everyone. Dave, go ahead and click to the next slide. And then just a quick sort of note about what Pulse is. Pulse is an annual poll at the Colorado Health Foundation that we've been doing for 5 years running now, that we do to take a pulse, no pun intended, of Coloradans across a range of issues that impact their health and well-being. This is not a single issue poll, but in fact, we ask people about a variety of different topics and also invite Coloradans to tell us in their own words the things that are important to them every year. We have a commitment to transparency at the Colorado Health Foundation, and so that means that we share all of the results, all of the data from the poll with the public, with policymakers, with media, and partners like you. Pulse for us is about listening and hearing from people outside of our own circles to gain a greater understanding of what people across Colorado are thinking and experiencing in their day-to-day life. And in keeping with our commitment to racial justice at the Colorado Health Foundation, we oversample African Americans, Asian American and Pacific Islanders, and Native Americans in Colorado. And I want to extend a special thank you to many partners in the Native American community and Indigenous community in Colorado that help us to achieve that oversample of Native Americans in Colorado, so that we're able to represent the experiences, the perspectives of those communities in today's data as well. I'm pleased to be joined by the research team that conducts this poll on behalf of the Colorado Health Foundation every year, who will be walking through a lot of data, a lot of information about what we heard from Coloradans in 2024 through Pulse. And the first part of that research team that I'll introduce to you today is Dave Metz. And Dave, I'll turn it over to you now.
All right, thank you very much, Kyle, and thanks for the opportunity to be with all of you today and share all of this fascinating data that we've gathered about Coloradans' views. I'm Dave Metz. I'm a partner with FM3 Research, and I am one half of the polling team you'll be hearing from today. I'm joined by my colleague Lori Weigel from Newbridge Strategy. The reason there are two polling firms involved in this research, as there have been throughout Pulse's history, is that we come from different partisan perspectives. When my firm does polling on partisan issues, we only poll for Democrats. Lori and Newbridge Strategy, conversely, when they poll on partisan issues, only poll for Republicans. But the two of us have been working together as a bipartisan team for over 20 years now, doing research around the country on issues relating to health, the environment, transportation, education, wide range of different subjects, to make sure that that research is both designed and analyzed from a bipartisan perspective. That said, I want to note that when we do the poll, we interview everybody. We interview Democrats, we interview independents, we interview Republicans, we interview Coloradans who are not registered to vote, each of them in proportion to the share that they make up of Colorado's overall population, to make sure that we really do have a good picture of what all Coloradans think. And to that end, you'll see a little bit about the methodology of our survey here. This is comparable to the methodology we've used for each of the prior Pulse surveys dating back to 2020. We were in the field doing interviews for about a month, from late May through the end of June of this year. We interviewed voters both by phone and online. We called them on landline phones, on wireless phones. We sent them both email and text message invitations to invite them to participate in an online version of the survey as well. And we conducted interviews in both English and Spanish. All of this with the goal of making sure that we had the most diverse and representative sample that we could possibly reach. We were speaking with adult Coloradans from across the state, and as Kyle noted, we oversampled Black Coloradans, Native American and Indigenous Coloradans, and AAPI Coloradans as well. We also took a closer look at Morgan County in this year's survey and oversampled responses from those members of the population as well. All of the data we got back, we then statistically weighted to by a range of different demographic and geographic variables, looking at the US Census, to make sure that the results line up with the proportions that we would expect to see in Colorado's adult population. And all the data we're sharing with you today is exactly that. It mirrors what census data tells us Colorado's population looks like, and what the poll tells us is what those Coloradans think. There's a number of places in the data where we'll be breaking out results by geography. And we've divided the state into 6 regions for this purpose. You'll see them shaded in different colors of blue on this map. We have the Eastern Plains as one region, the Western Slope as another, and in the middle of the state, you'll see we look at Larimer and Weld counties. We look at the Denver metro area, and then El Paso and Pueblo counties separately. And so you'll see breakouts for all of those individual areas within the data as we go through it. Now we have a lot of numbers we're going to share with you today. We've got, I think, nearly 60 slides that we're going to go through. I want to urge you all not to feel like you have to take frantic notes as you go through it. As Kyle noted, there's a full commitment to transparency with the results of the Pulse poll. This slide deck, as well as top-line results and detailed cross-tabulated results of all the data we're sharing today, will be available on the Pulse website. So you'll have a chance to go through it all at your leisure and take a closer look. So with that, let's go ahead and turn to what we heard from Coloradans this year. To do that, I'm going to hand it over to my colleague, Lori Weigel.
Great, thank you, Dave. Sorry, couldn't find the unmute button for a second. So let's talk a little bit about what the concerns of Coloradans are today. So we asked respondents to tell us what's the most important issue facing Colorado right now. I don't think anyone who lives here will be shocked, as I do, that cost of living, housing affordability really dominates those open-ended responses. So people could volunteer any issue that was on their mind, and we saw those really dominate the top concerns. As in the past, we also saw a number of people pointing to other issues, about 10% talking about concerns about government and the political climate, about homelessness in their communities, and about immigration-related issues. Notably, crime has ticked slightly down in some of the volunteered responses over the last year, but that's still in sort of a top tier. We also asked a slightly different question that focused in on what they saw the most important things that Colorado's state government could do to make life better for them and people they care about. Now, a number of these align very closely with what we just saw. They were volunteering and able to tell us anything that they wanted to see state government could do to make their lives better. Predictably, based on what we just saw, things related to affordable housing, lowering rent costs, was one of the top mentions, along with things like cost of living, inflation, pointing to food costs, which we'll dig into in just a little bit as well. So those received double-digit proportions of responses. And I think because we were focusing on government specifically, we also saw many more people talking about taxes than we saw specifically calling out taxes as the top problem facing the state. But 13% pointed to lowering taxes, fixing Tabor tax issues, things like that related to that. A number of respondents also talked about just wanting less government and, again, focusing on healthcare specifically. Notably, we had 8% pointing to something related to healthcare, whether that was in treatment, whether that was cost, but something related to healthcare in this open-ended question. So let's talk a little bit more about what really dominated those concerns, and that was cost of living. We have asked a question every single year since the inception of the Pulse poll, asking respondents to rate the rising cost of living as either an extremely serious problem, very serious, somewhat serious, or not too serious a problem in the state. And on the right side there, you can see those who said it was either an extremely or very serious problem. We saw a gradual uptick in the first few years, and numbers have been relatively stable these last 3 years in terms of the vast majority of Coloradans, in fact, 3 in 5, pointing to the rising cost of living as an extremely serious problem, and 86% this year, in line with the past few years, saying it's either an extremely or very serious problem facing the state. If we look at how people are feeling in terms of their own financial situation, that's remained relatively stable since last year. We have about 1 in 4 saying they're living comfortably with increasing savings. Another 1 in 3 telling us they're living comfortably but not increasing their savings. But notably, we have significant proportions, about 1 in 4 saying that they're just getting by, and 1 in 10 saying they're really struggling financially. And those numbers really haven't changed over the last year. Of course, there's some different subgroups that are more apt to say that they're struggling or just getting by financially. And on the next slide, you can see that predictably, that really aligns with household income. Those who are most comfortable tend to be in those upper income categories. as well as homeowners being much more likely to say that they're feeling comfortable and adding to their savings more so than renters are these days. If we look at the next slide, we have asked people to tell us relatively what they say they're better off, worse off financially than a year ago. Is their financial situation about the same? And again, we've seen that today we've got about 2 in 5 telling us that they are worse off. That's been relatively stable the last few years. We saw that big jump between 2021 and 2022 in terms of people telling us that they are worse off than they had been the year before. But again, we kind of hit a period of relative stability where we have significantly more Coloradans telling us that they are worse off rather than better off today. If we look at the next slide, that has some implications. First of all, in thinking about whether they are concerned about being employed over the next year, we have 1 in 4 Coloradans telling us, yes, I'm either very or somewhat worried about employment over the coming year. About 3 in 5 telling us they're simply not worried. And of course, some people are not planning on being employed at all, but maybe they're feeling okay about that. Again, there is an income dynamic, and I know these are so many numbers on all these slides, but just pointing out on the next slide, one of those being the income dynamic, where those in lower income categories, I'm not seeing the next slide. If we can flip to that one, are much more likely to say that they're worried. About 1 in 3 of those in the incomes under $90,000 for annual household income telling us that they are more worried. And then on the next slide, you can see that respondents of color and white respondents really have risen up to the levels that we saw Hispanic voters being over the last few years in terms of being concerned about being employed over the next year. One more slide on that. Predictably, those that are unemployed or temporarily laid off are the most worried, predictably, about being employed over the next year, and not dramatic distinctions based on geography, although Pueblo County is slightly higher in levels of concern about employment. I mentioned before cost of living, and one of those categories being concerns about the cost of food. And in fact, we have significant proportions telling us that they are worried that they might not always be able to afford enough food to feed themselves and their family. While this has ticked down slightly over the last couple of years, we still have 1 in 3 Coloradans saying they are either very or somewhat worried about being able to feed themselves and their family in this coming year. On the next slide, you can see again that we see a direct relationship to household income in particular, where they are far more likely to be concerned about being able to feed their family in the lowest income categories, as well as Native American and Indigenous populations, where we have a majority saying that they are concerned about that. On the next slide, you can see geographically, again, Pueblo County really stands out as a higher level of concern about food insecurity than in any other region of the state. And if we look at what that means, we have seen, and I'm sorry, in terms of respondents of color, we've also seen an uptick among AAPI respondents telling us that they are concerned about this, where we have some declines, slight declines among some other populations. So what does that mean? It means that that has some real world consequences. We have about 17% of Coloradans telling us that they are skipping meals because they couldn't afford food. That is significantly higher, again, among Native American and Indigenous populations, where we have 1 in 3 indicating that they're skipping meals. And among those lower income households, we have 44% telling us that they have skipped meals because they couldn't afford food. So some definite real world consequences of that food insecurity. If we look at what we can do about some of these things, we asked respondents to rate each of the following potential actions on how helpful that would be to them personally in terms of improving their personal financial situation. So they could say it was either very helpful, somewhat helpful, not too helpful, or again, that they may not know how that might impact them. Increasing the availability of higher paying jobs in their community was the one where we had nearly 3/4 telling us that would be at least somewhat helpful for their own personal financial situation. And majority said things like affordable professional education and job training, or help managing debt and improving their credit would be at least somewhat helpful for them. Notably, 2 in 5 said increasing the availability and affordability of childcare was something which is striking, given that relatively few Coloradans have children of very young ages, as well as reducing discrimination and bias in hiring, where we had 2 in 5 indicating that that would be helpful as well. Very quickly hitting on just a few of the underlying dynamics, we saw that the one that really crossed all subgroups here was increasing the availability of higher paying jobs in their community. We had the vast majority of all respondents telling us that that was something that would be helpful. But really, respondents of color are telling us that any of these ought to be helpful to them in terms of improving their personal financial situation. If we look at as well partisanship, we saw some distinctions, although we saw the vast majority of Democrats, unaffiliated respondents, and Republicans telling us that many of the increasing the availability of higher paying jobs was going to be helpful to their particular situation. But we do see some partisan distinctions on most of these potential actions. And then geographically, we also saw that Pueblo County, remember, they were sort of the most stressed in terms of personal financial situation. A majority in Pueblo County said every single one of these would be helpful, but we also saw a number of respondents and relatively few distinctions on many of these geographically. Notably, this high cost of living is something that has concerned Coloradans for some time, as we've already seen. But we have 7 in 10 now telling us that they are worried that they will be able to afford to live in Colorado in the future. And this is sort of a common theme, no matter where people are in the state, even what their racial or ethnic background is. Predictably, there is more of a relationship to income, but even in the highest income categories, we saw that a majority say they are at least somewhat worried about being able to afford to live in Colorado in the future. And that's even more acute when we get to thinking about the next generation of Coloradans. When we ask parents whether they are concerned that their children will be able to afford living in Colorado, and we had 9 in 10. And in fact, 60% saying they are very worried that their kids may not be able to afford to live in Colorado in the future. And honestly, really irrespective of who they are, their income category, or where they are in the state, parents are very concerned about that next generation. So I'll pass it to Dave to talk a little bit more about housing and some of those stresses.
All right, thank you, Lori. So as Lori detailed, the cost of living overall is an enormous concern for Coloradans. There are many components to it. But in this survey, as in past surveys, housing is the major driver. It is the aspect of the cost of living about which Coloradans are most broadly and intensely concerned. We asked a question, having respondents evaluate their concern about the overall cost of housing using that same scale Lori described earlier, rating it as either an extremely, very, somewhat, or not too serious problem. In this year's poll, 89% of those surveyed rated it either an extremely or very serious problem. That's the highest level that we have seen across the pulse polling. It has always been a concern to at least 2/3 of those polled, but it really has gone up in recent years and has reached a new high. At the same time, we also see rising concern about homelessness, which in the minds of many Coloradans is connected with the cost of housing. 79% of Coloradans rate homelessness a very serious problem in this year's survey, matching the high that we saw last year. and a full 12 points higher than in our initial poll back in 2020. So concerns about the cost of housing have a number of implications for Coloradans. One of them is being worried about whether they're going to be able to afford to stay in their own home. We asked them to think ahead over the next year and indicate how worried they are about the potential that they might either lose their home, have to downgrade it, or have to move because of costs, because they couldn't afford their rent or couldn't afford their mortgage. We've asked some version of this question every year, again, dating back to 2020. And in this year's survey, we see that about a third of those polled indicate that they are worried about potentially having to move. Again, that's the highest number that we've seen. That concern doesn't apply equally to every demographic group within Colorado's population. Not surprisingly, it is most acute among those with lower levels of household income. In fact, a majority of Coloradans in households with incomes under $50,000 per year are worried that in the coming year, they may lose their housing. And even among those in the next tier up, $50,000 to $90,000 in income, that number is just under half at 14%. And I think is a sign of the breadth of the stress that this issue poses for Coloradans. Even the wealthiest households, those with incomes over $150,000 per year, almost 1 in 5 are worried about losing their housing over the course of the coming year. We also see some differences here by race and ethnicity, as we do on so many questions in our polling. Only 30% of white Coloradans are worried about losing their housing, but significantly more Coloradans of color, in particular those who are Native American or Indigenous, indicate that they're concerned about losing their housing over the course of the next year. Those racial and ethnic differences, as we'll see here, have largely persisted over time, but have grown somewhat more acute over the years. For every single racial and ethnic group within Colorado's population, except for African Americans, who largely stayed about the same, we saw an increase in the proportion this year who indicated that they're worried about losing their housing. And there's one other really obvious correlation with concern about housing status, and that is whether one already owns a home. Renters, 54% of them tell us they're worried about losing their home over the course of the coming year. But even among homeowners, it's more than a quarter at 26%. So lots more housing insecurity among the renting population, but it is present among homeowners as well. Now, for the renters that we surveyed, we had a couple of follow-up questions. We had seen in past years' surveys that higher degree of housing insecurity among that population. And so one of the first questions we asked was who they rent from. And a majority of renters we surveyed said that their landlord is a large management company that owns several properties. Only about a quarter are renting from a small landlord, and then about 1 in 5 from a friend or family member. So for most Coloradans who are renting, their interaction is with a large corporate entity. There is also a sense of pessimism among renters when we ask them about the potential to own a home someday. For that rental population, we asked how many of them aspire to own a home, and the sentiment was near universal. 90% of renters would like to become homeowners at some point. But when we asked them if they thought they were either likely or unlikely to be able to purchase a home in Colorado, as you'll see, a majority of them said, no, I'm not going to be able to afford to do that, 51%. Only 39% of the renters that we talked to told us that they both aspired to be a homeowner and anticipated that they would become one in the state. Now, this is a question that we didn't think to ask 20 or 30 years ago when housing costs were not as high on the list of public concerns as they are today. But I think it is almost certain that the dream of homeownership was one that there was more optimism about in previous generations than what we're seeing among Coloradans today, where, again, a majority of renters just don't think that that's something that they'll be able to attain. And part of the reason for that is even in just trying to maintain their current level of housing, both renters and homeowners have had to make a number of adjustments to their lifestyle that they probably would rather not have made in order to be able to have the resources necessary to afford housing. More than a third indicate that they have worked multiple jobs or worked more than they wanted to. Right around 3 in 10 tell us that they've cut back on other needs like food or healthcare. And you saw Lori before talking about the number of people who had skipped meals in recent years in Colorado. Among renters, about a third have avoided asking their landlord to address problems because they didn't want to face a rate increase or the potential for eviction. And you'll see a range of other financial adjustments that Coloradans say they have had to make as we move down the slide. So clearly, it's the cost of housing is not just a financial burden, but it's causing them to make adjustments in other areas of their lives that they would rather not have to make in order to be in a position where they're not going to lose their housing. And when we look at the proportions of Coloradans that have had to make some of these difficult choices, disproportionately, Black Coloradans and Native American Coloradans tell us that they have had to make these kinds of changes at rates far higher than what we see among white Coloradans. So on this, as on many other issues dealing with the cost of living, we see some significant gaps by race and ethnicity in the experiences of Coloradans today. And of course, not surprisingly, there are big differences between homeowners and renters and between more affluent and less affluent Coloradans in the frequency with which they have had to make some of these kinds of changes in order to afford housing. You'll note that a majority of Coloradans with incomes under $50,000 per year have said that they have had to forego food, healthcare, or other needs in order to be able to afford their housing. So on the question of how best to address this, we had a question where we offered up 3 potential policy solutions and asked the respondents to tell us which one they thought would be the most long-lasting way to address rising housing costs in Colorado. So this is less about immediate needs and more about trying to fix the long-term structural problem that the state faces. And what came out of this was that respondents were divided. We had roughly a quarter that chose each of the 3 options we presented to them, with the remainder either declining to pick any of them or insisting that they wanted to do more than one. And those include making regulatory changes in order to make it easier to build housing, increasing renter protections and limiting rent increases, and then providing financial incentives to encourage the construction of more affordable housing units. So all of those things, to varying degrees, had a sizable number of Coloradans that said, yes, that seems like the best approach. On many issues, we will see significant partisan gaps on policy preferences. While we see some on this issue, they're frankly not great. The biggest difference that we see is on the proportion who chose that middle option, increasing rental protections and limiting how quickly landlords can increase rent. A third of Democrats chose that option as the best solution, making it their most selected item. Among Republicans, that was the third preference, with only 14% choosing it. But voters of all political persuasions were divided between which of these approaches they thought would be most effective. Not surprisingly, renters had a clear-cut favorite on this list. Almost half of renters chose the middle option of greater protections for renters, whereas among homeowners, perhaps not surprisingly, that came in a clear third relative to the other 2 options presented. Now, another key cost concern is the cost of healthcare. And this is, again, something that we've seen repeatedly in pulse surveys. And so we had a few questions to explore those dynamics in more depth in this year's survey. We asked the respondents to tell us how frequently or what kind of health insurance they have, if they are in fact insured. You'll see the responses that they gave us here. Almost 2 in 5 report having a plan through their own employer, about half a plan provided either by their employer or their spouses, 1 in 5 relying on Medicare, and then the remainder using a variety of different sources, being either self-insured, covered by their parents' health insurance using Medicaid or military health care. For those who are currently uninsured, which was about 6% of our respondents, we asked them to indicate what kind of insurance they previously had before they became uninsured. And for most of them, it was either Medicaid or some form of employer-provided health insurance. And when we asked them why they had not managed to get reinsured since losing their insurance, the answer was overwhelming. It was simply the cost of health insurance. For almost 3/4 of those who are currently uninsured, they said that that was the barrier that was keeping them from getting health insurance today. But whether Coloradans currently have health insurance or not, there's no question that they view the cost of health care as a major concern. 68% rated an extremely or very serious problem. And in fact, this number really hasn't budged across the various polls where we have asked the question dating back to 2021. So we've seen that increasing concern about the cost of living, increasing concern about the cost of housing, but the cost of healthcare has always been there as a significant concern for most Coloradans. And that concern also has implications as Coloradans look forward. We have about 1/3 of Coloradans telling us that they are worried that they or someone in their household will be without health insurance coverage in the coming year. That number is very similar to what we saw in the 2023 and the 2022 surveys, and higher than what we saw in our initial surveys in 2020 and 2021, when it was only about 1/4 who were worried about losing health insurance coverage. Again, there is a strong correlation with income, which reinforces the centrality of the cost of health care in Coloradans' confidence that they're going to be able to remain insured. Almost 3 in 5 Coloradans with household incomes under $50,000 are worried about losing their health insurance in the coming year, as are 41% in that next income bracket of $50,000 to $90,000. It is also the case that Coloradans of color, in particularly Latino Coloradans and Native American and Indigenous Coloradans, are more concerned about losing their health care than their health insurance coverage than are white Coloradans. We also looked at the responses to this question by the current type of insurance coverage that Coloradans have. And perhaps not surprisingly, it is those who are currently enrolled in Medicaid or Health First Colorado that are most concerned about losing coverage. 63%, more than 3 in 5 Coloradans who are currently covered by Medicaid are worried that they're going to lose it during the coming year. And those who are currently unemployed or temporarily laid off, I think given the reliance on employer-provided health coverage, also significantly more concern among that subgroup. There were a few other demographic differences that we thought were worth calling out in terms of the degree to which Coloradans worry about losing health coverage. Those who were born outside the United States, those who speak a language other than English at home, those who identify as LGBTQ+, and those who are living with a disability are all significantly more likely than those who do not fall into those categories to worry about losing their health insurance coverage over the coming year. So we see a lot of divisions within Colorado's population in terms of anxiety around health insurance coverage in particular. It's also the case that, much like when we look at the issue of housing, we see that Coloradans have had to make other lifestyle changes to address some of their concerns about the cost of healthcare. In this year's survey, more than 2 in 5, 43%, indicate that they have postponed medical or dental care over the course of the last year. We have seen in previous surveys, when we asked about their reasoning for why they've had to do so, overwhelmingly cost was the major reason. And when you look at the profile of the respondents who are most likely to say they have postponed medical or dental care, you'll see I think some of the connections there and some of the reasons that the centrality of cost as a rationale. It is those who are uninsured, those who are currently enrolled in Medicaid, those with low levels of household income, those who are unemployed or laid off, significantly more likely than other Coloradans to report postponing care. Again, I think implying a pretty close connection with the cost of that care. So that provides a broad summary of, I think, some of the findings around the cost of living and the impact that it's having on Coloradans. There's no question that this is an overwhelming set of concerns right now, and it's at the top of Coloradans' minds, and has implications that reach far beyond just what they are able to afford in their day-to-day lives, but many different aspects of their lifestyle and quality of life as well. So with that, I will hand it back to Kyle for some additional thoughts, and then we'll be happy to take questions.
Thank you, Dave and Lori, for walking us through this early look at this year's data from the Pulse poll. And thank everyone who's joined us today, and those of you who've been submitting questions in the chat. If you've been absorbing the data as you hear it and all that too, sitting on your questions, please do enter them into the chat right now. But we're going to start to go through the ones we've already received, and we'll keep an eye on the chat for ones that continue to come in. Dave and Lori, the first set of questions we got today are related to the results that you shared of the open-ended question we asked on this year's poll around things that folks wanted to see the state government in Colorado doing, and some curiosity about one of the findings, one of the more common categories that we heard in this year's responses to that open-ended question that related to taxes, Tabor, and all that as well. So wondering if you could speak a little bit more just around the nature of open-ended questions and how you sort and analyze that data and use that category of taxes, Tabor issues, and what you sort of group together in terms of those responses this year and the themes that you were hearing from people in their own words.
Yeah, so when we ask open-ended questions, the respondents tell us their response in their own words. Our interviewers record exactly what they tell us. If they're responding online, they just type in exactly what they think. Sometimes they'll mention a bunch of different items in one question. Sometimes there'll be one theme. Sometimes they'll explain it in some detail. Sometimes they'll just be very vague and short. And then after the fact, we try to group and code those responses into categories so that it's a little bit easier to understand the major themes that they're talking about. So on the issue of taxes, we had lots of different items that people mentioned and defining it as a problem. Everything from just saying taxes are too high to specifically calling out property taxes, which we actually did code as a separate category since there were enough people who were mentioning that specifically. I know there were some questions about Tabor and reforming Tabor in some sense. It was a relatively small number of participants who mentioned that, which is why we combined it into that broader tax category. And most of them were not very specific about what kind of change they wanted to see, just indicating that they thought it was posing an obstacle and needs some change. I know there has been lots of other research that's been done on that specific subject, which really could make up its own poll. But unfortunately here, we didn't have a whole lot of detailed feedback on that specific aspect of taxes.
We got a set of questions when we were sort of walking through the last section of data around folks' experiences with healthcare and health insurance in 2024, and some curiosities now that Pulse is in its 5th year being fielded and all that too, about how this year's sort of look at insurance coverage stacks up against what we've seen in previous years in Colorado. So know that you reported that the overall uninsurance rate in this year's top line data was 6%. How does that compare to what we've seen in Pulse in previous years?
Yeah, so it was well within the margin of error in terms of the uninsured. We had 8% in the first year, indicating that they had no health insurance. Hopefully I'm not reversing these numbers, versus 6% today. So, again, it's well within the margin of error, but it is a change in terms of what we saw back then. But relatively, we've kept those categories relatively the same, and we're seeing much of it in line with what we've seen in the past.
And in addition to what Lori mentioned, too, one of the superpowers of Pulse is the very large sample size that we have of the poll overall. So in this year, we talked to over 2,400 people in Colorado. So that allows us to look at different subpopulations within Colorado across a wide variety of different demographics. And we're getting a number of questions in the chat, essentially curious about what types of demographic indicators we have and what we might be able to sort of zoom in on specific populations in Colorado. And in today's slides and today's presentation, presentation, you really got the tip of the iceberg of what's possible in Pulse data. So you saw examples of breaking down the data by party ID, by income level, by race, ethnicity. You also saw some of the other categories that we have. So are people homeowners, renters? We asked people about their age, their gender, their sexual orientation, disability status, whether they were born in the United States or another country, as well as whether or not they speak English or a language other than English in their home. Just a note to you all of today's information will be available to you after today's webinar and also on the Pulse website, where we make all of the crosstabs, all of the data available to you and to the public, policymakers, and all that as well. So if there are particular population groups or crosstabs that you are interested in seeing, sort of finer grain detail on as well, please keep those questions coming to us, and we'll be building out more and more resources on the Pulse website in the weeks and months ahead that help you to sort of zoom in on the populations, the data points that you're curious about. On this question about the uninsurance rate and sort of healthcare coverage in Colorado, just on a personal note, in my early analysis looking at the data this year, this is one where geographic differences in 2024 are pretty striking to me, particularly when we look at county by county levels in Colorado. So across some of the largest counties in Colorado, we have enough respondents for each county distinctly to be able to look at the data for that county by itself. And just as an example, when we looked at the data for Pueblo County on insurance coverage in 2024, it was a 15% uninsurance rate in this year's data for Pulse. So we're seeing a pretty wide geographic variation on a county by county level when it comes to insurance coverage in 2024. Another sort of technical question that we got, Dave and Lori, was essentially about crosstabs and the way that we sort of report that kind of data and that way of looking at the data. And one of our listeners typed in the question, I'm hearing the term significantly more or less likely being used sometimes as you walk through the data. Is that referring to statistically significant differences? And how can people sort of note and detect where we are sort of seeing that statistically significant difference between different groups, or where the difference might not be statistically significant?
Yep. Lori and I as pollsters tend to use the term significant when a difference is big enough to be statistically significant. I can't promise that we never slip up and use it in a more colloquial way. But yes, when we use that language, generally that's what we're calling out. All of the data that we will make available will have the sample sizes that were asked an individual question, as well as for the subgroups that are asked that question. So it's possible to run those tests of statistical significance if anyone is interested in differences between particular subgroups and if they're meaningful on a statistical level. And if anyone has questions about that kind of analysis, please just reach out and let us know, and we're happy to answer questions in that regard.
We also got a couple of questions around the health insurance questions and the experiences of folks who are uninsured. One question was, for folks who are currently uninsured, a large portion of them, I believe it was about 1 in 4 folks who were reported that they were uninsured in this year's sample, said that their most recent type of insurance was Medicaid. And they were wondering if we have any information if that sort of loss of Medicaid coverage was related to the end of the public health emergency. I will sort of note on that regard, one of the things that is a limitation of Pulse and sort of the quantitative methodology we have here is it's a really good instrument for us to be able to describe people's experiences, what they are experiencing, what they are thinking. But it's limited in our ability to really dig deeper than that to understand the why behind those kinds of things. So for that 1 in 4 folks who were previously insured through Medicaid, the end of the public health emergency might be one of the reasons why Medicaid was their most recent type of insurance, but we would need to look at other types of data, other types of information to really dig deeper below the surface on that issue. Another question that we got was about if we have plans to include any questions around the cliff effect or loss of public benefit eligibility due to increased wages. Every year, one of the toughest things about putting together Pulse is the question, sort of the negotiation process of what do we have space to include in this year's poll. We at the Colorado Health Foundation have a commitment to being engaged and informed by community in everything that we do, and that includes asking folks like you about the questions that would be really useful, interesting, informative to your work, to your understanding of the communities that you're a part of or the state more generally. It's a tough call every year about what we can and cannot make space for in every poll. Our first draft of the poll is usually about 3 times as long as we can reasonably keep people on the phone or on their computer answering the survey this year. So if you have things like that we didn't include in this year's poll, but you would like to see information on in the future, please chat those suggestions to us or email us after today's webinar. That feedback is tremendously helpful to us as we sort of calibrate and build next year's survey to understand not just what's interesting, but also what's useful to folks on the ground in Colorado as we put together what is hopefully an informative and powerful survey to share with folks like you, as well as policymakers and media in the state. Another question about homeowners, and if we ask homeowners how long they plan to stay in their homes. That was not something that we have direct information on, but Lori, I saw you come off mute, so there may be something you want to say on that question.
Yeah, I was trying to respond in the chat. So Mary Ellen, I guess, I think we did not have the capacity to ask that question this year. But we have seen, I think there's other data in terms of real estate sales that is showing that people are delaying changing homes in a way that is directly affecting the housing market these days. So I think in terms of real estate sales and some of that, there may be some other more valuable data. It's hard sometimes for people to predict their future situations. So that's why we ask a lot more about what they're experiencing now than what their plans might be. But no, we don't have that information in the survey. I think we'd point you to broader real estate trends maybe on that one.
We got another question around sort of the data that we reported on folks in Colorado who said that they had postponed seeking medical care that they might need in the last 12 months, and asking if we have any information about the reasons why people might have postponed medical care in the last 12 months. That slide shared sort of information about the WHO. So which population groups, which crosstabs did we see that experience was more common among in Colorado? We didn't ask a direct set of questions on this year's survey, sort of digging into the reasons why people might have delayed seeking medical care. But this is a question that we've asked, I believe, on every year that we've fielded Pulse, or if not all 5 years, at least 4 of them. And in previous years' data, we've asked sort of a follow-up question to people who said yes to this. Yes, I have delayed seeking either medical or dental care in the last 12 months, to sort of probe a little bit deeper about some of the factors that might have led to that decision. In 1 year of Pulse, we sort of asked a follow-up battery of questions where we sort of prompted people to respond to specific things we've heard on the ground as reasons or sort of barriers to accessing healthcare. So we asked about transportation challenges, finding a provider or an appointment time that worked for people, cost challenges, whether or not there was a provider who spoke the language that the respondent speaks or makes them feel comfortable in their healthcare setting, and all that. And then we've also asked in an open-ended way, as a follow-up question to this, where people could say whatever they wanted to sort of name in their own words what it was that was preventing them from seeking healthcare that they thought that they would need. In both ways that we've asked that question in previous years, the sort of standout reason that we've heard it over time and through Pulse is its cost barriers that are the most significant thing standing in the way of people seeking healthcare in its sort of timely way, and the thing that's most likely to contribute to them delaying seeking healthcare that they might need. Dave and Lori, I know that wasn't specifically in this year's data set, but is there anything else that you would add to what we've heard over time in Pulse on that front?
No, I thought that was a good summary, and I think it's probably unlikely it would have changed. As you'll see, the proportion who say that they have postponed care has been pretty stable from year to year, a little bit higher this year than last, but roughly the same as 22. My suspicion is that the reasoning wouldn't be dramatically different either.
And on that note, I think that's another sort of peek behind the curtain of how we build the questionnaire for Pulse every year. One of the things that has become really interesting and really powerful about Pulse, now that we're in our 5th year of fielding the survey, is our ability to track trends over time and what is changing and what's not changing in Colorado over the years as well. So that means that On every year's survey, we sort of dedicate some space to repeating questions that we've asked in the past so that we're able to do that year-by-year comparison. But we also hold some space on every year's survey to ask a deeper set of questions about something that feels particularly relevant, timely in a given year, or that we think is sort of an underexplored sort of aspect of people's experiences and perspectives in Colorado as well. With that said, a final sort of preview, Dave, if you click ahead to the very last slide. One of the things that we've learned over time in our now 5th year of fielding Pulse is this is a lot of data, a lot of information. It's a lot to absorb and all that as well. So we try to make it accessible to different audiences by doing a phased release of it. So we've now adopted a practice where we sort of release early on the information, the data that we have around what Coloradans tell us every year is the #1 concern in the state. So that's why this year in this briefing, we focused on the data around cost of living, housing, and experiences related to healthcare, because those were the things that sort of topped the pile of concerns that we heard from Coloradans in the ways that we asked it on this year's survey. But we asked a lot more questions. And this, today, what we shared in today's release is really just the tip of the iceberg. And we have a couple more briefings coming up that take an even deeper dive and have more data to share with you about what we heard from Coloradans in Pulse in 2024. The next briefing like this that we'll be doing is coming up in August, on August 14th. And that's when we will release all of the data from this year's poll, including all of the crosstabs, all the questions that we have as well. So you'll see some of the information that we shared today from different angles, as well as another set of questions that we asked for the first time this year that relates to folks' sense of belonging in the communities that they're a part of in Colorado. And what is it that might make folks in Colorado feel like they do belong and are welcome in the communities that they're a part of? And what are some of the things that might contribute to them not having that feeling in the communities that they're a part of in Colorado as well? We'll be diving into that data in that briefing in the middle of August. And then in September, we'll be doing a briefing, doing a deep dive on the experiences, the responses of what we heard from Hispanic and Latino people in Colorado. That briefing will be presented in Spanish language with live interpretation into English, and as part of our commitment to language justice of not just fielding this poll in both English and Spanish, but also making all the data, all the results available back to community in both of those languages as well. On this slide and in a follow-up email that you'll get from us after today's webinar is information about how you could register for both of those upcoming briefings if you're interested in those other looks at what we heard from Pulse in 2024. And know that the slides from today's presentation, along with many other ways of diving deep into this year's data, will be made available to you both through the Pulse website and in follow-up to today's briefing. Again, thank you very much for joining us for today's conversation about the 2024 data from the Pulse poll. We really appreciate you. You'll see my contact information on here, and please reach out to us if there are elements of the data that you are interested in sort of diving deeper on, things that you're wondering about if we asked on this year's poll or previous year's poll, or if you have suggestions about what we should consider including in the 2025 edition of Pulse, the Colorado Health Foundation poll. And we are always welcome or sort of encourage invitations to have us come and present to different community groups or coalitions that you might be a part of as well. So if you, your organization, communities that you are a part of would like a sort of another walkthrough of this data in some shape or form, feel free to reach out to me with those requests as well. Again, thank you for joining us today. Thank you, Dave, Lori, and the entire universe of the Colorado Pulse Poll team. We really appreciate your partnership in making this happen and sharing what we heard from Coloradans back with community today. Thank you.